Walking pneumonia has been rising again across the USA and Europe, especially during seasonal changes and colder months. It's often caused by a bacteria called Mycoplasma pneumonia. Unlike regular pneumonia, this type is milder, but it can still make you feel sick for weeks if you don't recognize the symptoms early. In 2025, doctors are warning that many patients confuse it with a common cold or flu. So today, let's break down the real symptoms, risks, and when to seek medical help. And remember, for more important health advice like this, make sure to subscribe to the channel. Number 1. What is walking pneumonia? Walking pneumonia is a mild form of pneumonia that affects your lungs but doesn't usually require bed rest or hospitalization. Many people continue doing daily activities. That's why it's called walking pneumonia. Doctors in the USA and Europe note that the condition spreads mostly through coughing and close contact, especially in schools, colleges, offices, and crowded public places. It is not usually dangerous, but ignoring symptoms can make it worse. Number 2. Early symptoms most people miss. In 2025, medical professionals say early symptoms look almost identical to a normal cold. This is why people delay treatment. Common early signs include mild headache, low fever, sore throat, dry cough, feeling tired without reason. Because these symptoms are mild at first, most people think it's just a cold and continue their routine. Number 3. Core symptoms of walking pneumonia most accurate for 2025. Here are the main symptoms doctors are reporting. 1. Persistent dry cough. This is the biggest sign. A dry, stubborn cough that lasts more than 1 week is one of the strongest symptoms of walking pneumonia. 2. Chest tightness. A heavy feeling in the chest, not sharp pain, but pressure or tightness when breathing. 3. Mild fever and chills. Temperature may go up and down during the day, usually between 99 degrees Fahrenheit minus 101 degrees Fahrenheit 37.2 degrees Celsius -38.3 degrees Celsius closing parenthesis. Shortness of breath. Not extreme, but noticeable when walking fast, climbing stairs, or doing simple tasks. 5. Fatigue that doesn't go away. You may feel extremely tired even after sleeping enough. 6. Fast breathing. Some patients breathe quicker than normal because the lungs are slightly inflamed. 7. Wheezing. A soft whistling sound while breathing. 8. Long-lasting symptoms. Walking pneumonia doesn't disappear quickly. Symptoms may last 3 to 6 weeks if untreated. Number 4. Symptoms in different age groups. Because walking pneumonia behaves differently in children, adults, and seniors, here's what to watch for. Children USA, EU Schools Trend 2025. Persistent cough, fatigue. Ear pain common in kids, irritability, reduced appetite. Adults. Lung, dry cough, weakness, mild fever. Body aches, seniors, confusion, rapid breathing. Loss of appetite, worsening fatigue. Seniors must seek medical attention quickly because the immune system becomes weaker with age.
Number 5. When to see a doctor. Doctors recommend scheduling a checkup if cough lasts more than 7 to 10 days, breathing becomes difficult, chest pressure increase, fever continues more than 3 days, fatigue becomes severe. In the USA and Europe, clinics usually confirm the condition using a chest exam, blood test, or X-ray if needed. Number 6. Treatment options. Doctor-guided and safe for 2025. Most cases are treated with antibiotics, usually macrolides like azithromycin, depending on the doctor's advice. Never take antibiotics without a prescription. This can cause resistance and make the infection worse. Other doctor-approved supportive treatments include rest, drinking plenty of water, using warm fluids like herbal tea, taking fever, reducing medicine if advised, using a humidifier to ease coughing. Avoid smoking in dusty environments because they worsen lung irritation. Number 7. How walking pneumonia spreads. USA, EU 2025 pattern. It spreads through cough droplets, sneezing, close-spaced ouching, contaminated surface. That's why outbreaks are common in schools, colleges, camps, public transport. Good hygiene and early treatment reduce spreading. Number 8. Prevention tips for 2025 to stay healthy. Wash hands regularly. Avoid close contact with sick people. Wear a mask in crowded indoor space. Maintain strong immunity. Use a humidifier in dry winter months. Take vitamin C and D as advised. Conclusion: pneumonia may be mild, but ignoring the symptoms can make the infection worse and delay recovery. Recognizing the early warning signs can help you get proper medical care quickly and protect your family. For more important health advice like this, make sure to subscribe to the channel.